Welcome to Community of Care Conversations, brought to you by the Center for Excellence in Aging out of San Diego State University. My name is Brett Frankenberg, and it's my pleasure to welcome California State Senator Catherine Blakespear to join us today. Thank you for being here today, Senator. I appreciate it.
Well, thank you so much for having me. I'm thrilled to be here.
You bet. I'm really excited to talk to you, and I think one of the reasons I'm really excited to talk to you is you are such a champion for senior issues, patient protection, and that's really near and dear to my heart, but also very tangential to what SEAL, Center for Excellence in Aging and Longevity, does. So I'd like to jump right into it. I'd like to start really talking about the End of Life Option Act.
Right.
So recently, we've removed the sunset provision from that act, and now we've made medical aid in dying a right as opposed to a temporary experiment.
Right.
And so I would really appreciate it if you would talk to us a little bit about what that means for patients and seniors in particular who are facing terminal illness.
Yes, well, thank you. And that was a great way to frame it, that it's now a right instead of an experiment. So that was my bill last year, was to extend the bill basically indefinitely. So to remove the sunset on the End of Life Option Act. So the End of Life Option Act allows someone with a terminal condition who's within 6 months of death to work with their physician to access medication where they can take something and pass on their own terms. So it's really medical freedom. It's the ability to recognize that the end is near and that people don't want to suffer at the end. We know that everyone will die, but not everyone has to suffer. So given that people don't have to suffer for a long time, they can have control. They could have their family around them. They can have a celebration. They can also just decide, you know what, I have had enough. So it was really important to me that we remove the sunset, because what happens is that people are diagnosed with a terminal illness, but they might not actually be within 6 months of death for many years. And there was a lot of anxiety from patients and from providers who were concerned that the law wouldn't be around when they needed it. So part of it is just the peace of mind of saying, yeah, this was going to expire, and we don't want people to feel like it's uncertain what they'll be able to do.
That timing issue is very interesting. It really is. And I think you've also really framed the whole thing around dignity, autonomy, and then also you've put some safeguards in place. I think there are people that are the opposing voices, if you will. They're going to say that by removing some of those safeguards or making the access making more accessible, I guess I should say, is going to weaken those protections. Can you speak specifically to those guardrails and what that means to you and your values?
Yeah, so one of the things that I think is so important is that when people have not heard of the law or they are expressing concerns about it, I summarize it as the kids are going to kill off Granny.
Right.
It's this idea that people are going to hasten someone's death. In reality, there are not any examples of that. But what we really do see is that people's lives are extended far beyond what they would wish. So it's not that people are dying too early, it's that their life is lasting too long. And people, if you ask the individual person, do you want to continue? And the person has to have capacity. So they not only have to take it themselves, but they have to have the capacity to say yes or no. So people are disqualified if they have Alzheimer's or dementia or other neurocognitive diseases that make it so that they can't make their own decision, which this is one of the biggest concerns about the law, is that it's overly limited. But the reality is that people are not being coerced into dying. If anything, people are coerced into living, because there are people who are still collecting disability and Social Security when they're living. And also the medical industrial complex, if you think of it as all the medicines we take, all the hospital systems, all of the different interventions that keep people alive, it really isn't taking into consideration people's quality of life or their suffering. So I guess to answer your question, at the outset, I feel like the premise of the question is a little bit off because it assumes that somehow there is abuse. Now, the law has been in effect for 9 years and we haven't had any abuse. So there are no examples of this actually happening. And I think it's important to recognize that, because when you talk to actual patients and family members, it can be such a healing process and such a unifying process when people have to start talking to each other about that actual end. And you see that within families all the time. And people just feel a profound sense of gratitude that they were in charge. And it's also just important to recognize that when people aren't in charge, they seek other ways to be in charge. They commit suicides, and they find ways that are much more trauma-inducing for the survivors and become almost like their story. Like the thing that you remember about the grandparents is that one shot the other and shot himself. And those are not what you want to be remembered your whole life by, but people are so desperate to be in control that they resort to those types of things. Running this bill last year, I heard an enormous number of stories like that. I wish my mom had this when she passed. I wish this, I wish that, related to medical aid and dying. So it really does give patients so much more control of their lives.
That's really well said. And again, I think that frames it around the autonomy and the dignity that we're really trying to give those folks. And, as a healthcare provider myself, I've been around that. I've seen that. Where people are suffering and they want an end, and we want to give them a peaceful and one, to your point, that they can celebrate.
Right.
So going back to your previous career as an estate planning attorney,
Right.
I'm sure that's given you a front row seat to seeing when those end of life advance directives are either unclear or maybe unenforceable. So can you talk a little bit about maybe where the legislation is going to strengthen advanced directives and patient protections?
Yes, thank you. So before I was elected to the state Senate, and before I was the mayor of the city of Encinitas, I worked as an estate planning attorney. So I drafted wills and trusts and powers of attorney and advanced healthcare directives, and had a lot of conversations with people about their end-of-life wishes. And this would come up, this topic, but an advanced healthcare directive is you are assigning an agent to make decisions for you if you can't. So if you're in a persistent vegetative state, you can't make a decision. But you cannot be in that state and decide that you want to pass. You have to have capacity. So I don't see on the horizon that we're collectively, societally ready to assign an agent who would say, this person has Alzheimer's or dementia. They told me 10 years ago they didn't want to live like that. So I'm going to decide to give them the medication. I don't see that as something that we're ready for. So in some ways they're a little bit on different tracks, because the Advanced Healthcare Directive is only really used when someone doesn't have capacity. But the End of Life Option Act can only be used with capacity. So there really is this divide that happens, which is in a way unfortunate, because very few people in California actually used this medical aid in dying. I mean, it's a bit more than 2,000 people in the year. And so who accessed the medication. About 1,800 actually took it, which to me is a good recognition that people want it for their own peace of mind, but then they might pass on their own, and they just decide not to take it.
Right. Yeah, that's really impactful too. I want to pivot a little bit to another bill of yours, which is SB 242. And this one I think is really important as well. So in this bill, we're proposing an annual open enrollment period specifically for Medigap plans. I think the key to this is without medical underwriting. So I'd like for you to talk a little bit about how that maybe impacts the power balance between patients and insurers.
Yeah, well, it's important that people are able to access care. Absolutely. So it comes down to, we make decisions about Medigap plans or Medicare plans, and our health circumstances might change after that decision has been made. So having the open enrollment periods and when can people move, and being locked into things that don't serve people. Ultimately, the bill is getting at that. The idea that we should be able to have more authority and be more in charge of what kind of health care we need. And we don't want people to be bankrupted by their health bills. And this is a really urgent issue right now because of the massive cuts from the federal government. I mean, we're going to be facing a serious problem in California, particularly with our Medi-Cal population, which is almost 40% of the state. And there's a lot actually at risk and a lot that's in flux right now.
Yeah. And we've seen Medicare Advantage plans, the enrollment's down 2 years in a row. I think people are starting to understand that they do need to take a little bit more control over their health insurance landscape, particularly as we're getting older and those that are entitled to that Medicare benefit, the Medigap plans really do fill a very, very significant need. So let's talk about maybe seniors who have, let's say, cancer or ALS or end-stage renal disease. How would SB 242 really kind of protect them when they're at their most vulnerable?
Yeah, it's being able to have health insurance that covers the health problems that people have. Mm-hmm. So, having either being denied the care they need or having huge out-of-pocket expenses means that people aren't able really to access the care that they need. And so, we're working incrementally toward a system that covers people better.
I like that a lot. So there's some parallels between, let's call it end-of-life rights and Medigap access. Do you see a connection between those two in that it seems like when the patients need it the most, when their health changes, that's when their options tend to narrow. Do you see a connection there? And what do you think policy can do to maybe address those issues?
I think there's been an enormous amount of complexity added to our system, and so it can be so hard to sort out what does an individual person need. And that's why we have advisors, and there's a whole industry associated with trying to figure out what people need at different stages. To me, it seems like that complexity isn't serving people because there's just enormous amounts of paperwork and confusion about what is what. And also, for someone like me, I'm about to turn 50 and I don't have health problems, but I may because people develop them. So figuring out, where should you be thinking about, or should you be preparing in a certain way? It's all very uncertain. And in many ways, I also recognize the value of being able to choose your own doctor, that relationship, the trust that's developed, the expertise, when you find the expertise that you want to keep and are able to have a rapport with somebody, I really recognize that as a value as well. And we're seeing so much change and upheaval that people are having to leave. Their health insurance plans are no longer affiliating with certain systems. And then people have to leave their existing care. And sometimes people are in the middle of things like chemo.
Correct. Yeah, that's true. And there is a tremendous profit motive. I think that, unfortunately, you mentioned earlier the medical industrial complex. Right. And I think that is a big part of that equation. Yeah, for sure. You have another signature piece of legislation, and that would be SB 1257, in which basically we're modernizing the San Diego County Medi-Cal Advisory Board. So with that, can you talk a little bit about how you see the importance of local governance and then regional input as it pertains to senior health outcomes?
Yeah, people get their people get their healthcare locally, but we have all these policies that affect what is available to them. So having having systems that are efficient, that are serving people. And for example, if a board is too big and it can never get a quorum, so it cannot make decisions, that disadvantages patients. So trying to align our systems so that they work. That's one of the things I work on across many parts of my legislation, is trying to make state government work better for people.
Well, I love that. I really appreciate that. I don't think any discussion with you, Senator, would be complete without recognizing the tremendous lengths you go through to educate not just seniors, but the adult children of seniors and really the community at large with respect to the enormous amount of scams that are out there. So your senior scam stopper seminars, for example, I know that puts you kind of really in the thick of it. And I would love to hear from you a little bit about, some of the things that you're seeing, some of the trends that you're seeing, particularly as it pertains to healthcare and health insurance.
Yeah, so I've done a series of senior scam stopper events, and they've been really well attended and very interesting, of hearing from the FBI and hearing from about the types of things that people get exposed to. So I have a very close relationship with my mom and my aunt. My mom's going to turn 80, and my aunt is closer to 90. And so they're, certain things like they'll get text messages about the toll road, that you need to pay this bill immediately.
Sure.
I mean, a lot of people have received that
Yes,
message. Yeah. And so recognizing when something's a scam and that you shouldn't, you shouldn't obviously pay money, but you also shouldn't click on things. And sometimes too, just the stories that you hear about where there's a relationship built, and the scam is going a lot deeper than just a cold solicitation. It's somebody, they're gaining seniors' trust, and some seniors don't have their social isolation. They don't have a lot of contacts. And when somebody comes to the door or on the phone is willing to spend time with them and build a rapport, they can get drawn in. And so it's really being aware of that and recognizing that even after a long life, you feel like you could detect if it was manipulative. But in reality, it's very hard to detect that. So seeing when it, something switches into they want money from you, they want access, that, those are places where seniors can be really vulnerable.
There's no question. And of course, the scams are getting more sophisticated as time goes on and as technology improves. So I don't think any discussion around scams would be complete without addressing the elephant in the room, which is AI, of course, right? Everybody wants to talk about AI. So, again, I think you've been on the forefront of this, and I think it would be really helpful to end this discussion talking about maybe kind of what you're seeing from the federal, state, and local governments, what you're hearing about any policy, and also from law enforcement.
Yeah, there's a lot of discussion about AI. Last year, I think we had 54 bills in the legislature just about AI. And we have a new committee this year that's focused on those regulations. I mean, the concerns they're across the board. So it's about surveillance of the population and of workers. It's about teens online and suicide risks, and chatbots who are drawing people in, and especially youth, feel as if this is a real person they're communicating with, and then these horrible examples of helping write a suicide note and that kind of thing, which, we need to have better protections. There's no question about that. Figuring out how AI, though, is coming and is part of our life, and so is automation. So figuring out the way to integrate it into existing jobs so that it's able to reduce repetitive tasks, but not take away from the really important, elements that humans bring. Like one of the bills we had last year was called No Robo Bosses, and it was that you wouldn't be hired or fired by AI. That you would be able to have interaction with a person if there was a problem with your employment. And those are things that seem deeply fair. The idea that robots are going to start to be in charge of things it's a dystopian future, which really alarms a lot of people. So it's not clear really where it's all going. I think there's some the sky is falling perspectives, and then there's some like this is just part of the evolution of computers, and where we shouldn't really be so alarmist. And the reality is probably somewhere in the middle. But at the end of the day, we are all in charge of this. Collectively, and our decision making is in charge of what kind of regulations we have.
So I think the reality here is that technology moves at such a fast pace, and certainly faster than legislation can move. And so I think your initiatives to educate people, particularly seniors and particularly the adult children of seniors, is really appreciated. How do you see legislation catching up, or what can legislation do to try to keep pace with the rapid change, if there's anything at all?
You're right that legislation tends to trail after there's a problem. It's somewhat corrective or reactive. Setting in place frameworks is important, but we don't really know what exactly that future is going to look like. So I think we just do the best we can. We keep up on the news, and of course we need journalists who are reporting the news in order to be able to read the news.
That's true.
And we need partnerships with the federal government. The state can't do it all alone, and that's something that's really difficult right now, as there are cuts to science and our university systems and free speech rights, and we worry about our democracy and just really a lot of deep concerns. But we'll continue to work on it. It's certainly one of the top issues, and we talk about it all the time in Sacramento.
Well, I want to thank you for your work on not just the AI issue, but again, representing seniors, and the work that you're doing on the health insurance space too. It's really, really important. And I want to, again, on behalf of the Center for Excellence in Aging and Longevity, I want to say thank you so much for your time today. It was a pleasure.
Well, thank you. I really appreciate it.